Welcome back to our channel. Today we're focusing on a diagnosis question from the USMLE Step 1 exam that pertains to the gastrointestinal system. This example will help you understand how to approach clinical scenarios and make accurate diagnoses. Let's dive into the question. Here's the question. An 82-year-old Chinese woman comes to the urgent treatment center because of a 2-day history of moderate left lower quadrant abdominal pain. The pain is associated with fever, chills, nausea, and decreased appetite. She has not had diarrhea or constipation and has no history of similar symptoms. Her past medical history includes hypertension and hypercholesterolemia. Her most recent colonoscopy 10 years ago showed no abnormalities. She is taking lisinopril and atorvastatin with no known drug allergies. Her family history includes her father deceased from a stroke at age 78 and her mother who had hypertension. She does not smoke, drink alcohol, or use other substances. Physical examination reveals temperature of 38.5 degrees Celsius, pulse of 100 per minute, respiration rate of 22 per minute, blood pressure of 164/72 millimeters of mercury, and oxygen saturation of 98% on room air. She appears anxious because of pain. Her pulmonary exam is clear. Cardiac exam shows a regular rhythm without murmurs, rubs, or gallops, and the abdominal exam reveals hypoactive bowel sounds with tenderness to palpation of the left lower quadrant. The rectal exam shows normal anal sphincter tone, no masses or lesions, and the stool test for occult blood is negative. Diagnostic studies include serum electrolytes, liver function tests, and renal function are within normal limits. Blood tests show a hematocrit of 36%, hemoglobin of 13.0 grams per deciliter, white blood cell count of 12,000 per cubic millimeter, with 60% segmented neutrophils, 6% band neutrophils, 30% lymphocytes, 4% monocytes, and a platelet count of 350,000 per cubic millimeter. Urine analysis shows negative leukocyte esterase, nitrite, 2 white blood cells per high power field, and 0 red blood cells per high power field. A CT scan of the abdomen and pelvis is pending. Which of the following is the most likely diagnosis? A. Appendicitis. B. Colorectal cancer. C. Crohn's disease. D. Diverticulitis. E. Pseudomembranous colitis. Let's break down the scenario. The patient presents with left lower quadrant abdominal pain, fever, chills, and tenderness to palpation in the affected area. Given her age and the physical exam findings, we need to consider conditions that commonly affect older adults. Her symptoms include moderate left lower quadrant pain, fever and chills, nausea and decreased appetite, tenderness in the left lower quadrant, and an elevated white blood cell count with neutrophilia and bandemia. These symptoms suggest an inflammatory or infectious process in the gastrointestinal tract. The correct answer is D. Diverticulitis. Diverticulitis is a common cause of left lower quadrant pain in older adults and often presents with fever, chills, nausea, and an elevated white blood cell count. To recap, when approaching diagnosis questions, carefully consider the patient's age, symptoms, and clinical findings. Matching these to common presentations of diseases will help you make an accurate diagnosis. For more study tips and practice questions, be sure to subscribe to our channel and hit the notification bell. Thanks for watching. If you found this video helpful, give it a thumbs up and leave a comment with any questions you have. Good luck with your studies, and see you next time.